Children whose mothers smoke while pregnant are at much greater risk for a range of health problems, including low birth weight, behavioral disorders like ADHD, and lifelong breathing problems, including asthma. They are also more likely to become smokers themselves. But according to a Lung Association analysis of a national survey, 27.4% of pregnant women in rural communities smoke throughout their pregnancy, compared to 11.2% of their urban counterparts. That means rural communities, almost 28% of pregnant women are smoking throughout their pregnancy, and those in urban and suburban areas are at 11%. I know we have interventions aimed at quitting smoking during pregnancy. How do we reach the rural areas? That's just kind of, since we have so many public health advocates in the room, I feel like we should have a discussion at the end. But that'll be for later this week at the National Tobacco Conference. We have a specific group that we need to help. When accounting for these socioeconomic factors, pregnant women were still 2 times more likely to smoke if they lived in a rural area as compared to urban area. And those rural women who are pregnant smoked at the same rate as urban women who are not pregnant. Let's talk about exposure to secondhand smoke. As we know, in 2006 and 2010, the Surgeon General released a report that said there's no safe level of exposure to secondhand smoke. So in communities with high rates of smoking, we know that there's going to be high rates of exposure to secondhand smoke. A national survey of children's health, the percentage of children who live in a household with a smoker is considerably higher in rural areas. This is the top of page 6. 33% of children living in rural areas, 35% of children living in small rural areas, compared to 24% of urban children. So residents of rural areas are more likely to allow smoking in the presence of their homes and family cars, which most of their children are going to be in. If you go to page 7, let's talk about what influences and contributing factors we found. Living in a rural community is not in itself the reason for tobacco use differences and disparities between rural and urban, but there are some factors such as poverty, stress, targeting by the tobacco industries, contributing to higher rates of tobacco use in specific populations throughout the country. Other factors are more specific to the rural communities, like economic dependence on tobacco growing, a greater level of social acceptance of smoking. The result is a self-perpetuating cycle of high rates of tobacco use, social and personal acceptance as the norm, and policy environment that does not discourage tobacco use.